this edition of Joy in Our Town. My name is Arlene Makoko, and our topic is health, and we'll be discussing depression. And we're joined by Dr. David Hellerstein. He's the Associate Professor of Clinical Psychiatry, Columbia University, the Depression Evaluation Service. Thank you so much for joining us.
Thank you. Glad to be here today.
Great, great. And our first question is, what is chronic depression?
Well, depression is a state of low mood, poor energy, poor sleep, loss of appetite, feelings of hopelessness, helplessness, sometimes suicidal ideas. Chronic depression is when it lasts for a long time, and that could be 6 months, it could be 2 years. Many people that we see have actually been depressed for 20 or 30 years or more before seeking treatment.
How is it diagnosed? How do you do it?
Well, you do a psychiatric history. You find out how long the person's been suffering from the symptoms that they're having, what is going on in their life at that point, and whether they have any of these symptoms. Again, the low mood, poor sleep, poor appetite, and so on. And also, very importantly, you need to rule out that there might be some kind of a medical cause that might be causing the depression.
How can you you know, a lot of people are sad every once in a while. How do you separate depression from everyday sadness?
Well, that's a really important question because everybody goes through low periods. Everybody has losses. Everybody feels periods of sadness or grief at some point. If you lose a person, lose a job, and so on. But the important thing with depression, where the normal condition goes toward becoming a disease, is if the symptoms last for a long time, and if they don't go away, and if they cause impaired functioning. So a person who loses somebody but bounces back after several months, that person has not has a clinical depression. And very importantly, for chronic depression, people have been depressed so long that they may not even know what normal is anymore because they've been in a state for many, many, often years.
Interesting. Would you say that chronic depression is more physical or mental?
Well, it's really an interesting thing. Research has shown that depression is both physical and mental, so it's not a question of one or the other, but depression has physical signs as well as mental symptoms. So the physical signs, your body is in a high stress state, you have a lot of adrenaline, and adrenaline is good in the short run but bad in the long run because it causes elevated blood pressure, raises your blood sugar, makes you have impaired sleep, low energy, and actually over a long time the physical symptoms of depression actually kill. People with depression actually can have a lower life expectancy and much poorer health as a result for heart disease, diabetes, high blood pressure, and other conditions as a result of the physical signs of depression. At the same time, depression is a psychological or mental disorder as well, and that has to do with emotional depression, which is how you feel and your emotions, crying a lot, feeling sad. And also cognitive depression, which is thinking problems, so poor concentration, poor attention. And also there's a social aspect of depression where people have, they tend to isolate themselves, they tend to get withdrawn, they don't want to go out, they don't want to call people for dates, they don't want to look for jobs. So all those different parts, the physical, mental, psychological, and social aspects of depression all come together. And if you have it for a short time, that's bad, but if you have it for a long time, many, many months or years, that is really very impairing.
That's interesting. And so what can people do if they know someone who is going through this sort of a long period of depression?
Well, it's important to take an active approach. So it's important to, at some point, try to get the person who's depressed to seek an evaluation and then probably seek treatment. So the evaluation should always include a physical assessment by a primary care doctor to make sure there's not something physically wrong with a person. It could be thyroid problem, it could be heart disease, cancer, any number of medical conditions can cause depression. Obviously those things need to be evaluated and treated, but assuming there's nothing that's wrong, nothing shows up in the lab test, nothing shows up in all the other kinds of medical tests, then a person really needs a psychiatric evaluation of the depression to understand what type of depression it might be and what type of treatments would be indicated.
That's interesting. And you mentioned a little bit about suicide. What are some signs that people can be aware of when it looks like someone wants to take their life?
Well, suicide assessment is really important, and the first warning signs really are often expressed to friends, family members, loved ones of someone who has depression. So clearly, if someone says, I don't want to live anymore, I'm hopeless, things are never going to get better, those are warning signs. More obvious and frightening things would be a person who actually has a means of hurting or killing themselves, such as having collected pills or having some other kind of serious life-threatening modality around that they actually could take their own life. Even more serious than that is if someone who says, I'm going to or I'm planning to do something, and those are instances in which someone needs an emergency evaluation, calling 911 or emergency medical services to get that person to care if they won't go in on a voluntary basis to their doctor or to an emergency room.